So here is the next query that we are having from Rohan. So again, it is related to insulin. So what is insulin pump and which patients need one?
So insulin pump is a small portable computerized device that develops fast acting or rapid acting insulin to people with diabetes, mimicking how the pancreas works. It delivers insulin continuously as a basal rate, and it can also give additional insulin or correctional or bolus doses as needed, usually before a meal or sometimes after a meal to correct high blood glucose. So the insulin pump continuously delivers a small amount of insulin, called as the basal rate, to keep the blood sugars stable between meals and overnight. The benefit of using an insulin pump is that it delivers precise amount of insulin through a pump or through an infusion set, thereby giving only the right amount of insulin that you need. If you take insulin as an injection, you give it as a big bolus. The problem with that is that sometimes you give too much of it, and sometimes it can cause low blood glucoses. Whereas insulin pump uses the continuous glucose monitor, and it talks to it, it interacts with it, it looks at the blood sugar. The program will ascertain how much insulin is going to be needed in the next 1 hour or in the next 24 hours. It uses algorithms. Thereby, it will continuously give insulin. It will prevent a patient from going very high on the blood glucose or very low on the blood glucose. The technology is amazing that now that you don't even have to tell what your blood sugar is. You don't even have to tell what you're eating. You can take a picture of your food on a plate just with your mobile phone, and the computer in the pump will determine how much insulin you actually need. The technology is amazing. It is wonderful to be in the field of diabetology at this time. Yes, an insulin pump can be used both by type 1 diabetes patients and also type 2 diabetes patients, or even during pregnancy now. We use it a lot in pregnancy-induced diabetes, yes.
Doctor, India has become the diabetes capital of the world. And what is your thought on that? And what happened?
So, yeah, unfortunately, studies have shown that southern Asian countries have a condition called as insulin resistance, and then people think it is our genetics that we develop insulin resistance. For example, just to give you a brief example, a person who weighs 100 kilograms here in the United States may not develop diabetes. They may just have minimal insulin resistance. But a person in India who weighs 60 kilograms of weight will develop diabetes. It is very surprising as to why this is happening. They think it's because of genetic factors, but you have to understand, in the olden days, for example, to give you an example, my grandfather was not very obese. He was only 65 kilograms in weight, but he developed diabetes. The reason, because in those days, for him to go to the field, to plow the field, he didn't have tractors. He used to sell vegetables when he was very, very young. He used to carry those vegetables on his back, bring it to the home, take it to the market, sell it. But now we have tractors, we have, a modern machinery, we have cars. So we've evolved, but our practices have not evolved. Our food is not evolved. We still eat a lot of rice. We still eat a lot of carbohydrates. And I think that's one of the primary reasons. We are not working as hard as we did in the olden days. And I think that is one of the primary reasons. But genetic factors do play a role. I'm not denying that. But I think that is a primary reason.